There's 2 million people right now in Arizona that are on Medicaid. So this is a story a lot of people in our state are watching very closely, and budgets are always packed with a lot of big numbers. But behind those numbers, remember, there are people. We spoke to a woman this afternoon whose life could be changed in a very personal way if the proposed cuts to Medicaid are allowed to stand.
Donald Trump calls it his big, beautiful bill, an enormous budget proposal that includes trillions of dollars in spending and in cuts. It's a massive 1,100-page document that could drastically change the way people live.
You don't take the decision to adopt lightly. It's a lifelong commitment to a child who's already been through more than most.
Kiana Brown is one of those people. Like a lot of Arizonans, she's worried about what this bill could do to her family. Brown and her husband are the parents of 3 adopted children with special needs, 2 of which depend on Medicaid for their health care.
Medicaid through the subsidy provides all of their services, and our kids have multiple medical and behavioral health services. We have developmental disabilities in our home. We have a lot, which requires a lot of appointment and a lot of services.
The couple doesn't qualify for Medicaid, but their kids do through a program that subsidizes health care coverage for adopted kids. The program was created to incentivize more adoption of children that have already been identified with special needs. And there are about 35,000 eligible in Arizona right now.
For many of us, or for my family, the subsidy and the support from the subsidy, Medicaid itself, it didn't make the adoption process easier, it made it possible.
A previous analysis from the Congressional Budget Office showed that the current budget bill could cut billions from Medicaid. And another recent study estimates that about 300,000 Arizonans could lose health coverage as a result, including people with disabilities and young children. Now Brown fears her family could become a casualty of congressional politics.
If they go away, your kid's not okay. And you don't know what not okay would look like.
And now that the bill has cleared the House, it now moves over to the Senate, where it's expected to face even more resistance, guys.
Yeah, I was going to say it passed the House by the slimmest vote possible, a single vote, right?
Single vote.
And that was likely because President Trump himself went to Congress to pressure those Republican holdouts. What are we looking for when it goes to the Senate now?
You got the Senate there. They've got some different ideas about what these cuts should look like. They've got some different ideas about some new spending that would be included in this bill. And I think you might see some of the ideological lines break down and fractures amongst the Republican Party that you saw in the House. You're going to see some, senators that are going to want deeper cuts, and you're going to see some senators who maybe want some more measured cuts over there. Regardless, it's still going to face some resistance, but heading up until early this morning, actually, the fate of the bill was up in the air, and the president got what he wanted, even if it was by the slimmest of margins.
Yeah, the deadline, they said, by Memorial Day, and so we're waiting to see what's going to happen with the push in the Senate.
And again, you got to remember, 2 million people in Arizona on the Medicaid plan here. A lot of people paying attention to this.
Dennis, thank you. And while today's